Welcome to Move or Improve with Debbie. This is part 2 of a 2-part series on Medicare and Medicare Advantage plans. Now, you may already have a plan in place or you're looking at your options, but either way, I think you're going to learn a lot of insider tips from Brad Rothermel and Randy Phillip. They have over 50 years of insurance experience, and they're going to talk with me today about choosing the best Medicare or Medicare Advantage plan, and this is part 2. So if you missed part 1 last week, then you need to go back and listen so you can catch up and not miss out on any of the insider tips that they talked about. But let's get started with Brandon and Randy, and we're going to pick up where we left off on part 1. So how can seniors evaluate the different plans? How do you know what's offered and what they might need in the future? You want to talk about that a little bit more?
Sure. A couple of ways to evaluate the plans. First thing is understand that it is overwhelming. This is difficult for those of us that are in the industry, which is why, Brad and I specialize in this because it does take some time to understand the breadth. If someone were going to do a research for themselves, the government has a very good website set up, Medicare.gov. You can go to that website. You can get a ton of information. You can put in your zip code and you can see all the plans that are available in your area. And there's going to be a lot of plans. There'll be plans that are Medicare Advantage plans, full Medicare Advantage plans, which cover the medical and the prescription. There will be Medicare Advantage plans that just cover the medical and do not cover the prescription. And then there'll be standalone prescription drug plans that do not cover the medical. And so when you are evaluating your needs, I would look at, what kind of person am I? Do I need a wide list of doctors, or is there a particular set of doctors that I must be able to have access to? You're going to want to look at, okay, what's the list of prescriptions that I take, and which carriers have those prescriptions on their formulary, their list of drugs that they cover. I would look at the premium. Carriers are going to vary their premium based on what they vary their premiums on. I would then look at when you use the benefits. Okay, what are the co-pays per service? What are they charging me for a primary care doctor or a PCP? I had a knee surgery, so what's the charge for an outpatient surgery? What's going to be the charge if I have to go into the hospital? What are the charges for emergency services? Other things you're going to want to look at, am I a snowbird? So am I going to be spending 6 months here and 6 months someplace else? Because that's going to determine which plans are going to be best for me. So there's, and then I guess the last thing, we're going to toot our own horns. Speak to an independent agent, like Brad and I, and we'll be able to help you assess based on what's available in your area, the plans that are going to be best for your utilization.
So if you want, how would you decide if you really need a Medicare Advantage plan? What kind of priorities do you give to figure that out? And, do you want lower monthly payments, or what are the differences, and why would they pick a Medicare Advantage plan?
Sure, that's a great question.
Okay.
I was going to say, in terms of lower monthly payments, that's one that pops to mind. I've heard a scenario or a metaphor used here that a Medicare Advantage plan is sort of pay as you go versus the fixed monthly costs of a Medicare supplement. And so what I mean by that is there's a fixed monthly premium on the Medicare Advantage plan, and you know that whenever you go to the doctor, you're going to pay X dollars for that visit. And of course, there's a cap on the out-of-pocket limits and so forth. Another really key thing, as I mentioned, the Medicare Advantage plans use networks, and so that's always a good starting point to check if your current providers are in a given plan's network.
Interesting. Okay, so a Medigap plan would be like, if you don't mind, the higher premiums, or what would be the reason for picking a Medigap plan?
Yeah, so kind of think of it like this. I like to think of it like going to Vegas and there's two restaurants you could go to. You could go to an all-you-can-eat buffet, okay, so you're going to pay a little higher premium, or you can go to an a la carte where you're just going to pay for services. With the Medicare Advantage plan, you're going to have a lower cost on a monthly basis. So the monthly premium that you pay is going to be much lower. Okay. But when you use the plan, you're going to have a little higher, you're going to have copay, so it's going to cost you a little more. With the Medicare Gap plan or the Medicare supplement plans, you're going to pay a much higher premium up front, but when you use the plan, you're going to have little to no out of pocket. So if you think, going back to that restaurant, if you think that you're really, really hungry and you're a big utilizer of the services, it might be better, if you can afford it, to buy a Medicare supplement, a Medigap plan, because you're going to use it, meaning you're going to the a la carte bar and you're going to the buffet and you're going to eat a lot of food. Or if you're a low utilizer like myself, you might want to take a Medicare Advantage plan where you're paying a lower premium and you're just paying per services.
That's a good explanation. The only problem with that for me is I love Vegas, so I would go to the buffet in the morning for breakfast and then the family dinner for dinner. I just can't help myself. But anyway, that's a good
shrimp.
Yeah.
You know how they get shrimp in Vegas?
No, you just pull up a chair and sit right there and don't even bother. But one thing that we haven't talked about, and I think it's important because a lot of people have time now to travel, regardless of the plan, or does one plan cover better than another? If you're traveling, especially out of the country, what happens if you get sick? Can you use the Medicare capabilities, or how does that work with travel? That's very important.
Yeah, that is one area that I guess when they designed this plan, no one really thought about that. All right, so on original Medicare, if you are out of the country, you don't have any services. On Medicare Advantage plans, you only have emergency services, and Medicare supplements. You're only going to have emergency services. So what Brad and I recommend to our clients, even if you're under 65 and you have good insurance through, let's say, IBM, or GM, whoever, if you're going to be overseas, we recommend that you have an international travel policy. And I think you're seeing that to be much more relevant with today's events that are going on. I was at a sales event, and this was actually an insurance sales event, and we were over in Dominican Republic, and one of the VPs was riding an ATV, and he hit a tree, and he broke his leg, or it broke something in his leg. And so they took him to the doctor or to the hospital, and the hospital said, we're going to operate. And he said, why are you operating? They said, we're just going to see what's going on in your leg. So he was smart enough to say, just duct tape me and get me on a plane and send me to Miami. Now, fortunately, he was a VP in the company, so the company took really good care of him. But for the average person, if you're overseas, you really need to have an additional policy, and especially for folks that are on original Medicare or Medicare Advantage or Medicare supplement plans.
Well, let me ask this. Does this international policy, I think that's a really good idea, and it solves a lot of problems. Do you buy that just per trip? Like, say you're going to Europe and you just need it for like 3 or 4 weeks while you're there, and then it goes away? Or is this a policy that you have to renew every year and it goes across any kind of place you might be visiting outside the U.S.?
Yeah, great question. And the answer is that both options are available. So if you're going on, say, a big 2-week or 4-week grand tour of Europe or something, you can buy a policy that just, specifically covers you during that trip. Or if you're someone who, likes to travel quite a bit and has the means, and you're going to make 4 trips in the next 12 months, there's another policy that would just cover all travel during a 12-month period.
Okay, so it's again, it's renewed on a yearly basis in that type of situation. It's not forever,
Correct.
Never guaranteed. And is there any way that they could say, no, you're too old to travel, we're not going to insure you?
Some of those do have an upper, like a maximum issue age, but they're fairly liberal. I think it gets up into like mid-80s or maybe even higher.
Yeah, I flew home from a trip I don't know, it's been several months ago, and I sat next to a lady, and we had to stop in Dallas to make a connecting flight, and we started talking, and she said, "Oh yes, I'm going on a flight to, this is my 4th safari." And I said, "Well, how old are you?" And she said, "Oh, I'm 89." And I said, "Okay, I need to get busy." She's 4 safaris ahead of me, and she's 89, but she was having a ball. She stays at those fancy places, and they treat her like royalty, and she loves it. But I didn't ask her if she had a separate insurance policy for international travel. But anyway, back to the daily routine here. Talk a little bit too. I know some of these Medicare Advantage plans do provide some dental, but like I have a whole separate policy for dental work, and I'm glad I do, because I just got a bill for uncovered stuff that's not going to be covered under the policy, and it was close to $2,000. So I'm glad that at least they covered the bulk of it. But talk a little bit about what they can get out of a separate dental insurance policy.
Sure. First off, what you have to accept is that the insurance that you're going to, the dental insurance, this is the biggest issue that we have with our clients, or the biggest concern, is that the expectation is that the dental insurance that you're going to get post your employment is going to be as good as it was pre-employment, and it's unfortunately is not going to be that good. So we look at the benefits that insurance carriers add on, and sometimes they'll add on a certain dollar amount, say we'll pay X amount for cleanings, or we'll reimburse you or something like that. But it is good to look at separate policies that can augment the benefits that you do or don't have with the Medicare Advantage or Medicare Supplement or Original Medicare that you have.
Interesting. Okay, so I know one of you had mentioned something about creditable prescription coverage. What can you translate that into everyday language so listeners can understand what that means and why it's important? Yeah, why is it important?
Yes, so you may have seen, if you've been employed and covered under a group plan, you would get various notices when your employer's plan renews. A lot of people probably don't read those, but there's one of those that's called the Medicare Part D notice. And so what that refers to is this creditable prescription coverage. Now, creditable just means that it's sufficient, equal to or better than what Medicare considers a quality prescription coverage. And so when someone is coming into a Medicare plan, the carrier would often ask for if this person had creditable coverage up until they are enrolling in a Medicare prescription plan. And so it can be relevant, currently with the COVID situation, a lot of folks maybe getting laid off or having to kind of retire prematurely before they wanted to and whatnot. And so there could be a temptation, say if I'm in that situation and I say, well, I'll be 65 in 6 months, so I'm going to get on Medicare then. If the COBRA's too expensive, I'm just going to go with this short-term medical policy just to fill in that gap. So the only danger there is that then when they go to enroll in their Medicare coverage and a prescription plan or a Medicare Advantage, there could be a gap there of 6 months with no creditable prescription coverage, and that person could then suffer basically have to pay a late enrollment penalty. Even though they may have had creditable coverage for the past 20 years, now they have that 6 month gap, and then they're having to pay a penalty on their Part D coverage, and that penalty is ongoing. So just something else to keep in mind or consult with an agent on